Good afternoon, everybody. I'm Jayatri Das, Chief Bioscientist here at the Franklin Institute, and thanks for joining me again on another conversation about the science and the impacts of the COVID pandemic on everything that we're facing right now. It is my pleasure today to be joined by a special guest, Mark Nikolich, who's the CEO of Braskem America. And you may not have heard of them, but they're an incredibly important company for the situation that we're facing right now, because Braskem is one of the key manufacturers of a critical component of N95 masks. And they're local to us here in Philadelphia because one of their facilities is just outside of Philly in Marcus Hook. So throughout our conversation, we're going to be throwing out some trivia questions for all of you to answer in the comments to see, how good your knowledge is about the supply chain for the protective equipment that we're all relying on. And I'm going to throw out the first trivia question right away, which is, we want you to guess what the raw material that N95 masks are made out of. So what is that natural resource that N95 masks originate from? So, Mark, while we give people a chance to throw in their guesses in the chat, I'm going to do a quick aside because, and you've probably heard of this news as well this week. So I wanted to update our audience on some breaking news about a new drug that's been showing some promise for treating COVID-19 patients. And it's a drug called dexamethasone. And the results that we heard last week are coming out of a large randomized control trial in the UK that show that this drug has significantly improved the survival of really sick patients. So looking at reducing deaths among patients on ventilators by about a third, a fifth of patients on supplemental oxygen. So this is really exciting news. What's nice about this drug is that this drug has been around for a long time. So it's really cheap and it's plentiful and it's injectable. So in terms of administration and getting it to people who need it, we've got a leg up basically compared to some of the other new drugs that are in development. Now, one of the things that we've talked about before are there are kind of two categories of drugs that are being developed. So some drugs are targeting the actual viral infection from the SARS-CoV-2 virus, while others are being developed to treat the immune system when it overreacts, when patients get really, really sick. And so just to kind of clarify what dexamethasone is doing, this is in the second category. What it does is it's actually a hormone that can put the brakes on some of those molecules that the immune system really gets triggered when it overreacts. So it's a way to dial back that immune response when people get really, really sick. So just some key caveats to throw out here. That means that it's not safe as a preventative medication or for those who are doing just fine and stable without the drug. And we're still going to be looking for how patients react for longer periods of time. So far, the study's been shown that it seems to be working after about a month. But of course, it's not 100% effective. So we figure that, that more research is going to be needed to find other drugs. So if you have other questions about dexamethasone, throw them in the comments. We can come back to it later. But Mark, it looks like some people have been guessing coal as the natural resource that
it's actually a potential. It's a potential natural resource.
So give us the answer. Where do we derive?
Well, and I'm not going to get too complicated, right? But I want to walk kind of through where it comes from. So the actual N95 mask, and you're all very familiar with these masks. This one happens to say dad on it, if you can read that. I know it's mine.
Good to personalize them.
Made of a polypropylene non-woven fabric. So the base material is polypropylene, which comes from propylene. It's a polymer from propylene that is derived either from oil or natural gas resources.
Okay, so oil or natural gas, that's our answer.
Now coal, there are newer technologies that actually take coal to chemicals. There's some old technologies and some newer technologies, but predominantly those are used in Asia and I'll say 40 to 60 years ago in other parts of the world.
Okay, so for those who answered coal, maybe there's a smidgen
of a break, yeah.
So before we start talking about the process by which you go from crude oil to get to an N95 mask, I'm going to throw out another trivia question for our audience. So put some guesses in the comments. And we do have somebody who guessed polypropylene. So, props to the chemists out there. So here's your second trivia question. What percentage of a barrel of crude oil actually gets refined into polypropylene? So what percentage of a barrel of crude oil gets refined into polypropylene? All right, so put your guesses in the comments. And in the meantime, Mark, why don't you walk us through the process of going from a barrel of crude oil to an N95 mask?
Sure. So, Gayatri, I'll try to keep this as simple and as clear as possible, both for those that aren't scientists, I'm not a scientist, and those that are. So maybe I can walk the fine line in between. So essentially, and I'll take the barrel of oil route to what we do. So barrel of oil typically is going into fuels, right? That's the predominant use of a barrel of oil. And as they extract the fuels from that barrel of oil, they have some leftover products that end up in the petrochemical business, in the chemicals market. One of those is propylene. And so from a barrel of oil, you get about 5% by volume of propylene. And we take that propylene, we typically purify it, make it really, really, really clean. And then we polymerize it, which basically means we turn that gas, that petrochemical gas, into a polymer, into a plastic. And that's called polypropylene. We do that in Marcus Hook locally, but we do that actually in 3 regions, and we have 5 plants in the US that actually manufacture polypropylene resins. So then that polypropylene, and I'm going to show you a little bit. Can I show some stuff now?
Yeah, so we had some guesses in the 0.1% range. A few people guessed 3%. So the 3% are pretty close.
Pretty close. It's a small portion of a barrel of oil, but it's an important portion, obviously, for us. And it allows the refineries to run efficiently to make fuels. So we turn it, first of all, we turn it into this reactor powder, and it's kind of hard to see, but you can see how it flows. It's like a very heavy granular sugar almost, right? And this is unstabilized. It's just raw polypropylene powder that we make from propylene. And then we take that and we put some stabilizers into it, and we change the molecular weight a little bit of it so that we can process it into a fiber. And that's pellets. And you can kind of hear them. They behave a little bit differently. These are these little round beads of plastic. And we're very careful with these because we don't want these to get out in the environment in an uncontrolled way. These pellets we make, and then we put them into a hopper car, a rail car, big gray rail cars, and we ship them to our customers. What our customers then do with this is they make it into a fabric. And I'm not going to go too far yet. So if you think of your N95 mask, this mask is made up of a fabric, and that fabric is actually made, for those of you who have your masks handy, if you look at it, they're not woven fibers together. They're a non-woven fabric. So what this polymer does is it gets molten and it gets spit onto a web, and it makes a thin, I'll say randomized layer of these fibers, these spun bond fibers, melted fibers, and that becomes this non-woven fabric, then in various layers and various densities becomes a substrate for something like a mask that can filter. So that's a little bit about the process.
So I'm trying to use my fingers here to kind of talk about the difference between woven and non-woven, right?
Yeah.
So in a normal woven fabric, I can't, my fingers are backwards here, but we have these fibers that are over, under.
Yeah, think of a carpet, in a loom, right, where it's very obvious you can see the carpet fibers over and under. Exactly.
But if we were to look at a non-woven fabric under the microscope, you might see just this like tangled mat.
It would be squiggly lines and tangled mat, and it depends on the process. Some of those lines are all a continuous fiber, and some of them actually get broken in the process into smaller little fibers. So you see that more randomized lay down of fibers. Exactly.
So before we go on, I'm going to throw out another trivia question for our audience here. So we've talked about N95 masks so far, but which of these other types of protective equipment are also made from polypropylene? And your options are surgical masks, gowns, or sanitizing wipes. Okay, so what else is polypropylene made from? or made out or used to make. Okay, so again, throw your guesses in the comments here. And in the meantime, Mark, you mentioned that you're getting the crude oil that you're refining into the polypropylene, and then you send it on to customers. Now, you're kind of in the middle of the supply chain here, right?
Yeah, we are.
What kind of businesses are your customers? Because you're clearly not selling them straight to us.
Absolutely. So you can imagine we sell the polymer in these big hopper cars. So how does it get to this N95 mask that is at the doctor's office, at a retirement facility, at a nursing home, at whatever it is, right? And so we sell those first and foremost to converters that make fabrics. And they make, again, all different grades of fabrics, and we'll find out in a little bit some of the other things that those go into. Those fabrics are then sold to a fabricator that might actually fabricate the masks and then sell them to a distributor, or actually might make the masks themselves, whether it's a big medical company, big medical device company, or medical supply company. And then those are distributed where they're needed. So there's multiple steps still in the chain after us. Gets in a rail car, travels for about 10 to 14 days in the US, then gets converted into a fabric, travels again in either a truck or a rail car for another 2 to 10 days. So you can see it takes some time to a fabricator, and then they need to get boxed up and then delivered much more quickly at the end of the process to your local, I'll say, hospital or a medical center. So that's the kind of the whole process. Okay.
So you're really a kind of like the keystone of the process here.
Yeah, we're kind of right in the middle. Exactly.
Well, we've got one guess for medical gowns, and we've got some guesses for all of them. So we've got some smart listeners today. It was a bit of a trick question because, in fact, polypropylene is actually used for all of these, for surgical masks, for hospital gowns, for sanitizing wipes. What's the difference between, from the product that you create into what happens downstream to get to all of these different things?
Sure. So so there's a lot of different polypropylenes. I'll start there. We have probably 140 or so distinct grades in our portfolio in the US. But we make a very specific grade for these non-woven fabrics because this is going into medical, it's going into hygiene products, adult care, fem care, diaper backing, things that touch human skin very regularly. And so the grade needs to be very, I'll say, carefully designed and qualified to meet the parameters required to do that regularly, right? So that's number one. And then secondarily, you can imagine they're making these fibers not in a very slow fashion. These are very large pieces of equipment that make these fabrics at extremely high speeds. And so the rheology of the polymer is extremely important for them to be able to control both the denier of the fiber, so the thickness of the fiber, and how it lays down into this non-woven web, okay? So that's very technically, and that creates requirements around oxidation of the polymer, so it's got to be stabilized properly. Again, we have to maintain, I'll say, the all of the regulatory requirements to have it touching somebody's skin, so it doesn't have any reactants in it and things like that. It's a very stable product, right? And then it has to have the rheological properties to be able to make the fabric in a way such that it filters, right? So they can control denier and the density of the fabric. So that's why it's kind of a technical product. But the good thing about it, the good thing for everybody should know, we have a lot of capacity in North America to produce this polymer, not just at Braskem, but through the polypropylene infrastructure that we have in North America. We're actually supplying other parts of the world polypropylene for this specific use because they can't make as technical a grade. So there's no shortage of supply of PPE, as we call it for short, polypropylene for these applications.
So we have a question from the audience here. What's the environmental impact of PPE? Is it biodegradable? Does it go away automatically? What do we do with the volume of PPE?
It's a great question, and it's a very challenging question, right? So if you look at the front end and you think about the scale of manufacture, these lightweight fabrics and the function that they perform, it's all extremely efficient, low carbon footprint, easy to make, low emissions, very valuable in use, right? Then you switch to the back half. Well, what do I do with it now? Now, the reality with biomedical waste is that the vast majority of that is incinerated, okay, for good reasons. But when you start to think about just diapers, right? And this is a similar application, just diapers. Where do diapers end up? They end up in our landfills. So we've got to find better end of life solutions, even though the front end of the life of these fabrics is really positive. And on the medical side, the vast majority does get incinerated for safety reasons and then generates energy. But there's a piece of the stream that does not get incinerated and does not get reclaimed. And we have to find the best way, the most efficient and environmental way to handle that waste. So it's a very good question.
So I think this is a related question, but are there ways to recycle any of the PPE kits and safety gear?
Yeah, absolutely. And so I'm not going to get too deep into all the different things, but this is just a typical surgical mask, right? And the beauty of these surgical masks is it's outside of a thin, right, insert, so you can frame it around your nose. This is 100% PP, right? So
Polypropylene.
Clean, right? Yeah. So collecting them and recycling them is very possible. The challenge you have again is, do we consider this biohazard, right? Do we consider this a biohazard? Not yes or no. And then what do we do with it if we do that? Then we have to decontaminate it before we recycle it. And that process is laborious, has environmental issues associated with that. So it's a complex question they're asking. Technically, it's very easy to grind this up and recycle it. All of the scrap that's made when you make one of these gets ground up, recycled, and reused. The actual masks, though, that's a discussion around biomedical waste and how does society want to deal with it per se when we're talking about these nonwovens.
Yeah, I was talking with our environmental scientist earlier today, and we were just reflecting on the fact that, health crises just aren't good for the environment.
No, actually we go backwards, generally speaking, because we take a shortcut and we say everything's dirty instead of saying, well, what's really dirty and how do we deal with it, right? This is the challenge with society. We want things renewable, reusable, but we're not always willing to pay either the risk or the cost associated with it. So this is a big solid waste. It's a global issue around solid waste, right? Because the way I look at it is this, this used to be multiple layers of cloth, right? Cotton typically, and it would have some synthetic filter in it. Well, now it weighs, I don't know, it weighs a few grams, right? It's very efficient to ship, it's very efficient to make, but also what do you do with it when it's done, right? And that's the challenge.
That's a great consideration of the trade-offs there that we have to think about in the broader system. I think there's no one element of the supply chain that's going to solve that problem.
Absolutely, it does have to be holistic. We've tried to do it around really as a company. We've tried to demonstrate closed loop and circular economies around specific streams to demonstrate the ability to close the loop on plastics. In some places that's easy to demonstrate. In other places it's really tough because part of it's human behavior. Yeah, but we believe that once we start creating these circularities in society, that'll just it'll create a movement, and that'll create volume, and that'll create economic efficiency as well to help solve our solid waste issue.
So I want to switch gears a little bit, Mark, and I want to throw out one last trivia question for our audience here. So, you showed us some samples of the polypropylene that you make. So I want to ask people to guess from 1 pound of polypropylene, how many N95 masks do you think you could make? So again, how many N95 masks could you make from 1 pound of polypropylene? So throw your answers in the comments. And I want to ask that because, Mark, Braskem, had this incredible story, about a month, 6 weeks ago about the employees who actually volunteered to live in a couple of your plants to actually just make as much polypropylene as they could because of the crisis that we were in at the time. So can you, while people are making their guesses about the number of N95 masks from 1 pound, so we can scale up accordingly, can you tell us a little bit about the decisions that went into that idea for this live-in manufacturing model?
Sure. Well, I would say it first starts, and like many of you and like many organizations that we work for, we support, everybody kind of step back and say, how are we going to address this? And we treated it like a crisis through our crisis management structure and process. And the first thing we said is we want to preserve the health and safety of our team members. That was kind of the first thing. Secondarily, the communities in which we operate. So we don't want to be doing things in the communities in which we operate that could help the spread or aid the spread of COVID. And then the last piece of this was we wanted to make sure that we did what we could to secure this supply chain, right? And we thought from all of that would come also economic perpetuity, right? If we keep people working, we keep the businesses that we support working, and so on and so forth. So then we really delegate to the plants, and we have a plant in Pennsylvania, one in West Virginia, and 3 in Texas. So we delegated to the plants to really figure out what was their own context, their own environment, what was going on at their plant with their team members. And in the case of Marcus Hook, Pennsylvania, and Neal, West Virginia, both those plants were making product for nonwovens to go into the applications, the aforementioned applications, hygiene and medical applications. And they were also both areas that there was concern with bringing COVID into the plant, and conversely taking COVID from the plant home, where we've got team members that are caring for elderly or in high risk categories, so on and so forth. So we really left it to the teams. The teams then helped develop their own plan, obviously with support of leadership. And both the Marcus Hook and Neal teams decided that the best thing to do to secure the team, their community, and the supply chain was to not let anybody in and out of the plant, which sounds like an extreme concept, but we do this when hurricanes come through. You know, obviously Texas, it's more frequent than it is in the Northeast, but we're used to that. But that's usually for 4 days or 5 days. Both plants chose to live in for 28 days, secure the plant, no visitors, and just focus on keeping everybody in the plant healthy and safe, and operating to supply the critical needs of the market. And we're so proud of both of those teams. The volunteerism, they were all volunteers. We actually had more volunteers than we had need for in the plants, which was really nice. But the teams volunteered, and they just, you know, when you see that kind of camaraderie and effort and outreach, they were really focused on doing what they could to impact others during COVID. Just immensely proud. I'm just humbled by what they've done. So they both did that, and during that period of time, they made a lot of product. I'm not going to say because it could influence our question. They made a lot of product that went directly into supplying the hygiene and medical markets.
Okay, so we're going to come back to that, because we have guesses ranging from 10 masks to 400 masks. So
somebody's doing some good math, though, I think.
So Mark, how many N95 masks can you make from a pound of propylene?
Yeah, so remember that they're all a little different thickness, right? N95, right. The heavier gauge, right? So you can, I'm looking at my notes here because I gotta make sure I get this right. So you can produce somewhere around 150 masks with N95 masks with a pound of polypropylene. Okay, so that's a pretty good sized box. That's a pretty good sized box.
Okay, so now help us put this live-in effort into perspective. How much polypropylene, did you make during that 28 days?
Yeah, so these numbers get a little crazy. I'll try to keep it, rounded numbers and high level. So there were 2 live-ins that were 28 days each, and they overlapped by 1 week. So there was 1 week, they were offset by 1 week, I should say. They were offset by 1 week. And during that time, we made about 40 million pounds of polypropylene specifically for hygiene and medical, okay? And if you do the math, you end up with somewhere in the neighborhood of, over 500,000 N95 masks. And, you're well over 1.5 billion of your typical, lightweight surgical masks. So when we talk about scale, that's scale. That's why I say there's a lot of polymer that can be produced for this. hopefully we'll get to a point about, well, why is it not getting to everybody? But I think, there's the country should feel very safe that we've got plenty of capacity to produce this polymer for this use.
So I do want to come back to that point because I think that's a really important one, but we do have a couple of questions circling back to the question of waste, and specifically about, now that, these kinds of masks have become a consumer product, so not just in the healthcare, in hospitals and things like that. What should everyday normal consumers know about disposal? Does it get discarded as, as plastic or paper or glass that consumers can think about?
Yeah, absolutely. Well, first of all, it is a plastic, and I know that's confusing when most people look at it because it looks like a fabric, right? And they don't think of fabrics as plastics, but a lot of our fabrics are synthetic. From a consumer perspective, and look, I'm not going to quote CDC recommendations. I'm not a physician. I'm not an infectious disease expert. Okay. But I think with any of these things, we need to follow what the CDC recommends and how we use and how we reuse. And you've seen a lot of media attention around that. My view is what the CDC says we should follow. And that's what we've been trying to do as a company. Having said that, these masks, once it's yours, it's personal. This is my view. And so as long as you're healthy, you don't need to be changing these out. They are a protective measure. And just like anything else, when the CDC says you can leave your mail out for 6 days, and after that, you should be fine with it. You can do the same thing with these masks. So use them for their durability. What we do in a hospital under crisis conditions is very different than what you should do in your household. And the precautions of we're just throwing everything away in a hospital, I understand. In the household, you have control of that. You as a consumer have control of that, and be smart. We don't need to throw everything away. What can we use? What can we use multiple times? And look, this N95 mask, my wife is a geriatric nurse. So she happened to have some of these lying around. So I had this day one, and I still have this one, right? I've gone to a more cloth, comfortable fitting one, but I keep my pure N95 mask handy, and it's still very durable, and it's dad's for a little while. So that would be my recommendation. I don't think we have, if you start putting these in your local curbside recycling, I don't think we have the infrastructure to handle that. So that would not be my recommendation at this point. I would love to say that everything that goes curbside gets recycled. We have to be smart about that. And there's been a lot of, I think, education around recycling recently as to how to keep things clean and make it easier to recycle. I would say keep reusing until it's worn, until it's beat up, or until such time as that you've been exposed to somebody or yourself are suspect case, and then it's something that you should dispose of.
I think that's really great advice, because some of the things that we've talked about in our conversations before is that when if you're exposed, the dose matters, and just walking past people is a pretty low exposure. So being mindful about what risk your behavior actually puts you at gives you some options in terms of being able.
Now, if I can get my plug in, Geometry.
Yeah.
Polypropylene is very recyclable across a broad spectrum of applications. And so make sure you're looking at those cups, making sure you're looking at those containers that are PP, rinse them out and put them in your recycle bin. We need them.
Yes, absolutely. So check your local recycling regulations to see what you
exactly.
can recycling. Absolutely. So I want to circle back, Mark, to the point that you brought up before, because we are there's some discussion about whether we're through a first wave or whether the first wave of COVID is continuing. But one way or another, we know that we're going to be living with this for a while. So where do our PPE needs as a country stand right now? What do you see from your perspective?
It's a great question. And look, again, I don't claim to be an expert, but I'll tell you, just as a citizen, as a member of an industrial community that's involved in the supply chain, I still hear stories where we're short. And it doesn't make sense to me because it's not logical. Okay. Now, this has to change, but it has to change the distribution point. The production point, we can expand production. We can expand production tomorrow. I believe that our customers who converted into fabrics can expand. It's about allocation of line time and what's needed, right? So I believe they can expand it to the needs. After that, the fabrication and how they get, we need to have better controls over that because it's clearly not uniform. And the stories, at least that I've been hearing, are those communities that don't have a lot of money, those communities that are in poorer sections of the country are the ones that are struggling to get it. And this is exactly what we can't accept in our country today. We can't allow economics to determine where safety measures go. If that's what we're doing, it's no surprise the masks aren't getting where they're needed. So we need to throw that concept out and figure out how to get the masks where they're needed. So I think this distribution aspect of it, once it gets into a fabricated mask, where do they go? This is where we need local governments. That's where we need, I'll say, private industry and local governments, private industry, health industry, and local governments to work together to make sure they're getting where they need to get to. Because there's plenty of supply of the basic materials. It's not a constraint. So hopefully that makes sense, but that's where I think this needs to go.
Yeah, and it's a problem that's not confined to PPE either.
No,
as we're talking
unfortunately,
about,
it's not. Yeah, it's
as
just
we're talking
another
about
example.
dexamethasone too. With the positive results of this drug that came out last week, there's similar concerns about this medication that, even though, we should have, a ton of stocks of this drug, it's been around forever, it's not necessarily in the right place. And, we out of, everybody's concerned about it. And so you have tendencies of, of stockpiles being in some places where the need is in other places. And so this is a bigger problem again.
Yeah. Toilet paper, I can understand. Medical needs, I cannot understand. And it's so clear with the CDC and everything that we know who's at higher risk. And that's where the allocation should be going. I'll say the unfair, that's where the majority of the allocation should be going to the risks. So yeah, it's a big struggle. And unfortunately, we all know it's not only PPE and it's not only medication. It's in a lot of areas. And I think this is part of what we've been living, hearing, feeling the last few weeks, right?
That's right.
That's what we've been hearing.
Yeah, these systemic problems.
Yeah, absolutely.
So if we want to end on a positive note here.
Yeah. Yes.
What's your hope in terms of where a company like Braskem can contribute to the solutions, and what advice would you give to whether you're in the medical field or or in the consumer side about what to expect in terms of this type of distribution in the future?
Look, I do think if we have a second wave, and the reopening is a challenge. Humans don't like to be cooped up. And clearly, at least in US society, I'm seeing this in other parts of the world, Braskem operates we have we're derived from Brazil. We have a very large operation there. We have an operation in Mexico. We have a large operation in Europe as well. And you just see the different cultures, different regions of the world are dealing with it slightly differently. And I think in the US, clearly there's a strong desire to reopen. And I would say with limited controls in place, right? People are bursting at the seams, and we're seeing, the cases spike up in a lot of different areas that were essentially safe previously, right? So this is where the Northeast is actually benefiting, because we were such a hot zone that I think the Northeast is conditioned. You go to another part of the country, not so much. So I do envision that we're going to be dealing with this for a while. The question is, are we dealing with it on a level where it overcomes our medical infrastructure or not? My belief is no, but my belief is we're going to be dealing with this for a while longer, and we're going to have to continue to iterate, how we view things like PPE and how acceptable they are or should be in society and public and business where we work, so on and so forth. And that's something we're going to have to contemplate. I do believe that the supply will get better. This was an instantaneous, turn on all the engines. Some weren't firing, right? So I do believe we've gotten through that. I think it's everybody's responsibility to change the inequities in society. But I do think that the supply chain will react better in the fall and be able to protect us if people are willing to accept the protection. And this is the challenge, right?
You know, I think about that a lot from a communications point of view,
It's tough,
because, you know, at the beginning, you know, before we really understood how, you know, this disease was transmitted from one person to the other, you know, everybody's, you know, from the public health side, the advice was that, you know, if you're healthy, you don't need a mask.
Right.
And then trying to flip the script once we
hard.
started to understand the disease is really hard.
Yeah.
But I think, you know, now that we're in a position where the supply isn't the constraint anymore, hopefully we can make some more headway into.
Yeah, and I hope that, I hope the end of the distribution chain that's really supplying to the clinics and hospitals, that they're really thinking about where they're supplying and why they're supplying and what's the motive here, and taking the high road, right? That's all we can ask. And I think you get through the first wave of this, I think we will have that. I really do. I'm an optimist. I think people will rally, and the right voices will win out in the end.
All right. Well, Mark, thank you so much for taking the time to join us today.
Computer's making noise. I apologize.
No, you're good. Everybody out there, wear your masks. Now you know how they're made. So hopefully you have a better understanding of how they work and what it took to get from that barrel of crude oil to the mask on your face. It's a fascinating story. I've been really interested as I've learned more about it. So Mark, thank you for sharing what your team has been doing, and certainly thank you to all the volunteers at Braskem who really stepped up when we needed.
Thanks, Teatri. I really appreciate it. We really appreciate the Franklin Institute staying strong and continuing to deliver messages that society needs. So we really appreciate the time, and look, we're going to continue to do the best we can to maintain the supply chain on behalf of the people that need.
Great. Thanks so much, Mark.
All right. Take care.
You too. Bye-bye.